All right. Awesome. Awesome. All right. We're going to go live. Hi, everyone. This is the face and the voice of Dr. Tolu Olabinto. I'm the CEO and co founder of Living Spring Family Medical Center here in the awesome city of Mansfield, Texas, where we believe in helping our patients live long and well because we believe the quality of life is just as important as the quantity of life. I am happy tonight to be giving another discussion that would help improve the quality of life. Of course, the topic today is a pretty serious one and one that's important nonetheless. And I want to appreciate those of you who are watching live, hashtag live, those replay, hashtag replay. And I want to introduce our guest. I'll give her some time also to introduce herself, but I'm honored to have on Dr. Neeraja
Yeah,
Kairam. Did I pronounce that right?
Neeraja Kairam.
Neeraja Kairam. She is a board certified pediatrician, and she's doubly board certified in both pediatrics and pediatric emergency medicine. She has, believe it or not, spent over 25 years in the hospital pediatric emergency department setting. Now, she has agreed to come have this conversation with us because it's more on a personal note for her, and she has taken on the new challenge of managing her late husband's pediatric practice over the past 3 years. And she's agreed to talk with us tonight on the topic Grieving with Grace, Navigating the Journey Through Grief and Loss. Doc, thank you so much for coming
Thank,
tonight.
thank you for having me.
All right. I know I did a little bit of an introduction, but I'll start with asking why did you choose peds? What did it for why peds?
That's a good question. I think I've always loved kids, especially the babies and the toddlers. So I've always gravitated toward it, and but I kept my mind open during med school, and I actually
Mm,
really enjoyed surgery and OB/GYN as well. But in the end, I really wanted to be there for little children, and so that's how I ended up choosing peds. And I met my husband, my late husband, in med school, and he ended up doing pediatrics as well. And we actually coupled matched into a residency, and we did our residency together as well. So
wow. And 25 years, is that correct? Wow.
almost just shy of 25 years. Yeah.
Okay. Awesome, awesome, awesome. So we're talking about grief today, and if you don't mind, could you share a little bit about your story, and so you coming on to have this discussion, and we'll go from there.
Okay, sure. Well, I guess it all started about 3 years ago, November 29th to be exact, 2020. I had come back from a late shift early in the morning, and found my husband collapsed on the ground. And actually, my oldest son, we were looking for him. We couldn't find him in the house and found him on the other side of the bed on the floor. And it was clear to me that he was gone and probably had been gone for several hours. Ultimately, I think they think it was sudden cardiac death, which apparently is an epidemic in South Asian males. I was not aware of that. But that was the moment that my life changed because, he was a general pediatrician running his own private practice. And I was doing my full-time career as a pediatric emergency medicine physician and director of the department and managing, our three kids. And then in that moment, everything just fell apart. And it was pretty much a blur in the beginning, and it took a lot of time, patience, and self-reflection, as well as growth to get where I am right now. It's a little over 3 years since he's passed, and I can tell you through this learning process that I'm a different person than I was when he passed. I'm a different person than I was 2 years ago, even 1 year ago, and I know I'll be a different person
Mm.
1 year from now and going forward. It's definitely been a journey and not an easy one, but I see a future for myself. And I think that's the biggest thing I can impart, that there will always be a life to live and a future for anyone who has lost someone so dear to them.
Mm, mm. So what would you say to that person who's watching, who's who's been in your shoes, and maybe this is relatively fresher for them?
Yeah, I
Mhm.
think
Yeah.
it's it's hard in those moments. You really can't think about anything else. You're just living, moment by moment. And what we'll often say is you take one breath at a time, you take one day at a time, or 1 hour at a time to get to the next steps, because all of it, there's so many aspects of it. Whether it's, financial, will, probate, managing the kids and their grief, and other family members, it's all overwhelming, and it's easy to kind of crumble under all of that pressure. And the best thing you can do is not think so far ahead, which is natural. I did it relentlessly. Is to just kind of take it moment by moment, because that's all you can do. You don't have the bandwidth for any more than that.
Take it moment by moment. Um, Now, for someone who's watching, who's going through maybe the different expressions of grief, in your own personal experience, and also based on what you know, are there different telltale signs that someone is still in grief, is still grieving? And the reason I ask this question is also for the family members or the support system, so they can still recognize the symptoms and still be a support system through that season.
Yeah, I think the signs, symptoms of grief are so variable from person to person. No one person grieves like another person, so it can be hard to identify. I can tell you, with the exception of a few very close people to me, I put on a good face publicly that I was okay, and and people thought it was okay. So I had this public persona, of me being strong and brave and just doing what I had to do, and then I had this private persona that was, struggling. And so even if people seem like they're doing well outwardly, I wouldn't presume that that is always the case. And the only way you can really know is by truly asking, and not just asking, how are you doing, but truly, really asking, how
Mm-hmm.
are you doing? How are you doing really? Because that's a different question that the person who's grieving will receive differently. I've got the question, how are you doing, a gazillion times. And my response is almost always, I'm fine. I'm getting through it. But then occasionally someone would ask, how are you really doing? And then I felt the willingness to open up to them, because I thought, okay, they really want to know, and I am willing to share it. So I think that's really important for people who are trying to help people who are grieving. If they want to be in that capacity to truly support them, it's to really ask those hard questions that most people, I think, aren't always willing to answer, frankly. Yeah.
Mm-hmm. Now, one of the common feedback people give when that's said is, well, I don't want to ask so I don't trigger something, or I don't want to ask so I don't make them feel worse or help make them remember. What's your response to that?
I understand that, because I was that person before my husband died. I think I had a strong discomfort, and I think many people do in our, industrialized society, where the discussions have grief have been kind of compartmentalized and not talked about.
Mm.
Um, I think, I recently saw a video of a woman, she was also a physician, who lost her son suddenly in a car accident. And she was talking about how it helped when people asked specifically to bring it up, to say their child's name, to, not fear the triggering. Yes, it may trigger emotions. That person may start bawling in front of you. We have to learn to be comfortable with those emotions, because that is what the person needs. they need to be able to express their grief in a supportive and a comfortable and safe environment. And my experience has been that it's hard to do because of the way we are conditioned in our society to hold in our emotions in a way that's not helpful for ourselves, for others, and for the children that we're modeling our behavior to. And I did that myself. I held it in. I didn't want my kids to see me crying for a long time. And I recognized that I was doing them a disservice because I was telling them that it's not okay to show their emotions. And that's what we have to do if we want to move forward with the grief.
What I'm also hearing in listening to you speak is, focusing more on the person who's grieving. So it's if they need to do that in that moment, being okay with it because that's what they need to do at the time.
Yeah.
Yeah.
I think being okay with it is hard when you're uncomfortable with it yourself. And there's a tendency for us, the people who's not, trying to support the griever, to want to fix things. But a lot of times it's not about fixing anything. It's just being an open heart, a warm hand that's holding your own hand. It's just about listening with an open heart. That's what most people who are grieving want and need, so that they don't feel alone and isolated in their feelings.
Now, knowing some of the discomforts and the barriers to getting the support during this season, are there tips for advocating for one as someone who's grieving, how to advocate for themselves to get better support? I don't know how else to ask that question. Like, how do you ask for what you need during that season? Because it's important, even when people don't get the cues and people don't know what to say, what to do. Is there how? Because there's still a need for support.
Yes. And honestly, when you ask someone who's newly grieving, what do you need? What can I do to help? There isn't really an answer most of the time because you're so overwhelmed. I think you don't even know what to ask for in those early days. And then when you get to a point where you think you could ask for things, we traditionally have a hard time asking people to help them. It's just the way many of us have been raised. It's almost like a sign of weakness. I think on top of asking what you need, if you can help them with resources, even if you haven't experienced that type of grief, there are resources out there. If you research them, you can send it to them. It's up to them if they want to use it at that point or not. They may never use it. I had gotten information about grief camps for my kids. My kids were not interested, but I appreciated that information coming to me. And then another colleague of mine who lost her husband a year before me reached out probably within a week or two of my husband passing and said, hey, there's a physician widow group that is a great source of support for all of us who have lost our husbands. And I remember seeing the word widow, and just bawling, like, that can't be me. But in the end, that community was a huge source of support. So I think a lot of it is finding the community that understands what you're going through. And they are all around. Most communities have widow and grief support groups that people can join, where they can be with like-minded people who fully understand what you're going through without judgment.
Thank you for sharing that. The support system, the support groups. And I like how you said you can offer the care you deem necessary, even based on your experience. And it's up to the person to take, and don't take it personally, because our focus is on helping the person through the season. And so we share, it's their decision, not yours. Hey, you must do this. It's here are outlets. Thank you. My next question to you is, let's talk self-care. What are ways that through these seasons that one can care for themselves in a way that makes for it to, I'm not sure the word is make it easier, but still help one thrive?
Yeah. Self-care is probably the hardest part. I think, especially when you have, family members that are counting on you, your focus is really on them. And in my case, it was my 3 kids, and everything I did in those early days was about making sure that they were okay. And in the process, you suffer more because you're not taking care of yourself, whether it's sleeping, eating, or just taking some alone time, to kind of be by yourself and be with your emotions. And in those early stages, tend to be a lot of people around. I was surrounded by a lot of people, other family members, friends, in those early stages, and I did find that I didn't have time to myself sometimes, and I didn't realize I needed it until I would find that driving in the car was the only time where maybe I would be by myself. And sometimes I would drive home and I would park in the garage and realize I don't want to go in yet because that's my time, right? And sometimes that's the time when I could really fully cry and let out some of the emotions before going in and being there for my children. I think we feel guilty when we take time for ourselves, and it doesn't change when you've lost, a loved one. There's still that guilt, and we need to learn to understand that if we don't take care of ourselves the best that we cannot take care of the other people in our lives that are counting on us. Took me a while to get there, but I did realize that.
Awesome. Awesome. Now, for those who are watching who are not maybe in the same shoes, but are like, I know people.
Yeah.
I have loved ones that I would love to be a help, but it seems I'm not doing a good job or I don't know what to do. I know you've mentioned some, but what are ways friends and families can best support someone who is grieving, both immediately and in the long run?
Okay, so immediately, I remember one of the biggest things that was helpful, and it's very common nowadays, is meal trains, where groups of people set up schedules for delivering meals to your home. And I think that entire first month, I did not have to make anything. I didn't have to think about food for my kids. There was so much food, sometimes too much. But it was a big weight off of my shoulder. Even when you're not going through that, thinking about what to make for dinner can be a chore. And then on top of that, you have all the other burdens on you. So that was a huge, huge help for me. The other thing is, I think, especially as you go out more from the time, weeks, months later, people would reach out so much in the beginning, and it was a lot, but I was grateful for it because that meant they cared about me and they cared about my husband. But I couldn't respond to all of them because it was just too much and too overwhelming. Over time, it went down, right? And that's expected and normal. But there was always a few people who continued to check on me, even people who I wasn't that close to. And I still remember to this day those people who would send me a text or send me a card and say, just letting you know that I'm thinking about you and stuff like that. Can I do anything for you? I'm in the area. Do you need anything from the store? I can bring it over right now. So those things were definitely helpful. And then I think just that sense of community. It's hard. It's like you want people around you because you don't want to feel alone. And then when people come, you want them all away. So you could be alone. And so it's like a no-win situation. And I think if people can understand that, they can just ask the person, I'm here for you if you want me here. At the moment you feel like you need your space, I won't get offended. I will leave, and I will come back again when you do want me here, and not to take it personally. And the other thing that really stood out, especially during the holiday seasons, which are very difficult for people who've lost, a loved one right around the holidays, especially. But my husband died maybe 3 weeks before Christmas, and the first one, I think we were still in shock. So I don't remember too much about it. But the second one, I was very anxious about it. It was a lot of worry about how I was going to feel, how my kids were going to feel. And one of the things that happened, which just shows you how strong uh, an important community is, helping you kind of thrive through all this, was we started receiving gifts like the 12 days of Christmas. So 12 days before Christmas, we started receiving gifts on our front porch, and we didn't know who they were from. It just said, signed your 2 friends. And at the first day, I was just like, okay, that's weird that I don't know who it is. Didn't think much of it. But then the next day, more gifts arrived. And it said, on the second day of Christmas, your you. And that happened for 12 days. And we never, ever knew who it was from. And then on the 12th day, I was worried that I was never going to know who it was. So I wrote a long thank you note and put it on the mailbox so that whoever was dropping this, and we did have a camera and we didn't recognize it. We were never home when they dropped it, but we never recognized the people, and it was different people. And on the 12th day, I sent the thank you note. I saw on the camera that someone took a picture of it to share with whoever was sending it. And then on the 13th day, we received an explanation, and it was a book called The 13th Gift. And it was the story of a woman who lost her husband just before the holidays, and strangers did the same thing for her. And it got her out of the slump of the holidays and the sadness and the depression. And I can tell you, I experienced that both for myself and for my kids. It was something we looked forward to. And we had fun just trying to figure out who it could be. And to this day, we still have no idea what it is. But isn't that the true spirit of giving, when it's selfless and you don't need recognition? Yeah, to this day, it touches me that people did that for us and our family.
Blown away.
Yeah.
And to do it without getting credit for it, too.
Exactly.
Wow. This has been very, very insightful. I really appreciate you coming to share this. I have one more question before we wrap up, and that's the touchy subject of, when people are a little insensitive, it's like, the length of grieving, or, I've gotten feedback, oh, it was this long ago, or that. For the person who's watching, who's like, yes, I've been in this, grieving process for a while. Are there tips to encourage them? And the second part of the question is, how can people be careful, a little bit more careful with word choice? Any tips on length? Like, you don't decide. I'm sorry. Yeah.
Yeah, I think that's a common, even for the griever, like you tell yourself, I should be over this by now, right? Or when do I get past the grief? And the honest answer is that you never do. The grief, it doesn't leave you. It becomes a part of you, and you learn to live with it in a different way. So in the beginning, there's a lot of crying, sorrow, depression, but the frequency and the depth of those seem to decrease over time as you start to navigate this new life that you never imagined or wanted. I think the idea that anyone can tell you that you should be past this is a fallacy. No one ever gets past it. They just learn to incorporate it into their new life. And that's a journey, and it's a process. And depending on, how you grew up, your cultural conditioning, so many factors will impact that. And, just earlier this week, I'm like, I'm doing well. I feel like I'm moving forward. And then 2 days ago, I started crying because I missed him so much. And I've heard that from fellow widows who are 10 years out, that it hits them all of a sudden. So it never goes away. It's just that we learn to incorporate it and accept it and deal with it better over time, I think. Yeah.
Wow. Thank you so much. So word on the street is that you have taken over a very beautiful pediatric practice in the New Jersey area. I'm going to put you a little bit on the spotlight because there's a warmth about you that that exudes the pediatricianness in you. Like you're a mama bee. Just even how you talk, you have a soothing voice, and I can see kids gravitate towards you. And so for someone who's watching, who's like, are you accepting maybe new pediatric patients in your practice at this time?
Yes, we are kind of full right now, so we are,
I love it.
but that doesn't mean that won't change. I think if we're taking babies of current families, but
Okay.
new patients, we here and there we might be able to accept them, but it's not open yet until we hire another person.
I love it. I love it. You have a beautiful practice. But Doc, I really appreciate you taking the time. I've learned a lot too, just listening to you speak. And I pray for continued strength for you, continued grace to keep pouring like you do, even as a physician, as a mom, and everything else that you do. So thank you again, big time.
Thank you so much, and thank you for having me and to be able to share this with other people. I hope it's helpful in some capacity.
Yes, yes, yes. And for those of you who were watching, please share this with people who find this encouraging, uplifting, and hopeful for them. Remember, it's all about improving the quality and quantity of life. Thank you all for watching. I'll see you all next time. Bye.
Bye.